Hi there. This video is about how you can use and make sense of the KPIs, the key performance indicators that we've developed for different modules. So if we come to clinical reporting and we come to the recall folder, each module has its own KPIs folder. And each folder is split into two main categories, really. The first is your sort of practice position, which is looking at where are you at in terms of patients who need review still invites. And then the second half is about system utilization. So of the sort of key features and things that you could be using, what are you using lots? What are you not using at all? So just to talk you through briefly some of this and how you might dig into it. So you've got a kind of annual review section here. So we're looking at how many annual reviews were coded last month, who was invited last month, who was invited last month and hasn't yet responded. Then this is a position about how many invites are due to be sent. So for this practice, quite a lot. We only just put September's in, so I don't think September invites have been sent. But you can see also the difference between QOF and best practice and QOF only. Then we've got our recall statuses. So this is in alphabetical order, but the sort of flow is that they start as blue, they're going to be invited later, then red, they're not responded, pink once it's in progress, and green once it's complete. Amber is some things are done, some bits outstanding, aqua requires visits, black is excluded or declined. So that can be either a patient's declined or they're a child where the condition they've got actually is always monitored in secondary care, or their GSF amber or red, things like that. Through the year, you would expect these numbers to change and your greens to be going up, your blues to be coming down, and that's a sort of general trend. Follow-up, this is our fairly new development about arranging patient-specific follow-up, who's due, what's been arranged last month, and then monitoring being the other kind of big chunky section. So again, what monitoring invites were sent last month, what's due to have a first high-risk drug monitoring invite, where it's for ad hoc or routine. And they sort of tally with what's in this folder. So the high risk would be like this. It says shared care, overdue critical annual monitoring, critical tests after starting new medication. Ad hoc is sort of included in mainly in the routine monitoring. And that's sort of joined together. You can also then get a sense of where you're up to in terms of patients on monitored medication who've got some kind of monitoring due. Now, lots of patients will have some sort of monitoring due because that will include things like, an ACR that would be good to do. It depends a little bit, actually, thinking about it, on your setup and the medication monitoring. Some of these numbers might be higher as well because we've added new things in, so they've not been done. But they're not necessarily urgent, pressing things. They may well be absolutely fine to wait until their next annual review. Then you've got more specific categories. You've got DOACs that are due monitoring. The high-risk annual monitoring, so that's kind of like ACE and no UNE in the last 14 months. Very overdue, similar, but with the last 17 months. Bloods needed following antihypertensive initiation, statin initiation, or dose change, and thyroid initiation. That statin one is often quite high because it will pick up things like a dose increase from a few years ago. Again, doesn't necessarily mean it's urgent and needs doing right away, but when they next come for their review, that will get picked up. And perhaps the highest ones of concern would be the shared care drugs. Again, these patients may well have had multiple invites. They might be getting the right interventions they need, but it's just a bit of a snapshot, really, of where you're at. Then system utilization is looking at the last 4 weeks. So this section where it says last month, we mean last calendar month. And that's partly so that if you want to export this data, drop it into Excel, keep it as a snapshot and sort of track your progress, you can do that. System utilization, is looking at the last 4 weeks. And so again, this gives you an indication of how well are you using the system. Some bits you may be very deliberately not using. Some bits you might expect to see in there, but you don't. So, for example, the annual review booking guidance, that's where it pops up, or you click the red shapes. It tells you to what the patient needs an appointment. You click book now, and it runs you through the options and appointments that the patient needs. When it does that, it adds some codes in the background. That's mainly so we can work out, is the annual review booked? But it does also mean we can see, is the guidance being used? as well as the number there, though, you may also want to look and see who's using it. So if you were to break it down, I thought I had run it. No, that was yesterday. Yeah, there we go. So you could break it down on, it would be this one here, event details, and you could do event done by and refresh. You would then look at the numbers, and it may be that you can see certain reception staff are sort of using it all the time, and others have got very low numbers, or perhaps even reception staff you'd expect to be in there aren't appearing in there. Follow-up at this practice has not been used in the last 4 weeks. I mean, it's an optional thing. Some practices are using it a lot more, others not at all, and that's fine. Annual review invites and monitoring invites, those are much bigger numbers. I think they've been doing some catching up on the annual review invites here. Again, as long as you're seeing some decent sort of numbers in there, that's kind of what you'd expect. But you can keep an eye on that. Then questionnaires. So asthma control questionnaire, that can both be the full one to do the full review, or sort of pre-appointment one that we've done that's a bit shorter. If these are all zeros, which they may be, the general review one, you probably see a fairly high number because that one's attached to the standard annual review invite messages. These other ones won't automatically be picked up, but there are various places in the system where you can send them. So if you come to this folder 3 other and section 1, these are patients who have recently been invited and have booked an appointment in, and they're either preset messages like please remember to bring the urine sample, or questionnaires that are good to try and get them to complete beforehand. Not essential that you use them, but if you do, you should find that sort of the flow of appointments and things gets simpler because those questions aren't having to be asked in those appointments. Recall overview. So when the recall overview template is used, it drops a code in. Again, that's another one where you might want to break it down and check, are staff using it? Are there people you would expect to be using it who aren't? Request one-off tests. So again, our GPs more often than not, perhaps workflow staff, maybe others, are they using that appropriately? The blood groups, that's a separate page on the request one-off test template where you can order, I don't know, tired all the time bloods or rheumatoid screening. Again, not essential, but useful. And then the select test for monitoring, that's our template where you're saying things like 6 monthly PSA for this patient. When you are first going live with a system, you'd expect that number to be probably a fair bit higher because you're probably transferring over patients from old systems like scheduled tasks or recalls onto it. Once you're up and running, that number probably will be fairly low. And it's really only patient-specific monitoring that you would expect to find in there. So when we are supporting practices, if we've got access, you've given us that access and we're logging on, personally, I'd often quickly run these to get a snapshot and see, did you know you could be using this feature and you're not? That kind of thing can be helpful. The plan is that as we develop new features and significant things, they'll be added to the KPIs. If there's other data you think would be really helpful, please let us know. You can happily build a few reports that will be useful for you and other practices. We've done something similar for prescribing. Pathology still needs a bit more work. We'll probably do separate videos for those, but I hope that gives you a sense of how to make use of them. And as ever, give us a shout if you need any help. Thanks.